I am Dr. Pawan Poddar, Consultant Interventional Cardiologist at Yesuda Hospital, Malakpet. Today I am going to discuss a very important topic. We have seen a lot of instances of sudden cardiac death in young people. We have seen a lot of young celebrities dying of sudden cardiac death. So let us see some important reasons for the occurrence of sudden cardiac death, especially in young people. And let us look at what are the causes and how do we investigate and treat these individuals. So let us first look at the causes for sudden cardiac death in young people. First important reason is development of heart attack. Many of us feel that many times heart attack patients will come only with chest pain, but sudden cardiac death can be a manifestation of heart attack in many individuals. Many of these individuals may not live to reach the hospital also. About 5 to 7% of patients with heart attack, they die before reaching the hospital, and most important reason is sudden cardiac death. Many of these patients develop abnormalities in the cardiac rhythm. Their heart beating becomes very fast, sometimes reaching up to 250, 300, and if a defibrillation or the shock is not given in time, most of them will succumb within 5 minutes. This is what happens in many such cases. So a heart attack is an important risk factor for such individuals. And why do these individuals develop heart attack at such a young age? So there are many risk factors which have to be looked into. What we have seen in our practice, many of these young patients who come with a heart attack, the most important risk factor in such individuals is presence of cigarette smoking. So smoking is an important, very important risk factor for development of heart attack in young individuals. Other important risk factors are most of these young individuals, they have a very stressful life. Many of them have many targets to be met at their workplace, and this puts a lot of stress on them. Stress, lack of sleep is an important risk factor. Lack of proper diet. Many of these individuals, they take a lot of fast foods. Their food timings are not proper, and they are not engaged in regular physical activity. And what we have seen with these celebrities, many of them, they do a lot of physical activity, but they do a very intense workout, which is also not good for the heart. Sometimes when we do such intense workout, there may be dehydration, and their blood may become very thick, and there may be formation of fresh clots in the coronary arteries, which can lead to heart attack. So exercise should be done, but the exercise which is more beneficial to the heart is a sort of aerobic exercise, where you do sustained continuous workout like brisk walking, swimming, some sort of dances such as Zumba and all can be done, and even a form of jogging is also helpful. But when you do intense workout with weights and all, sometimes that is not very good for your heart. Many of these individuals with sudden cardiac death, they also have a form of disease of the heart muscle, which is called as cardiomyopathy. An important type of this cardiomyopathy is the hypertrophic cardiomyopathy, which doesn't cause any symptoms, which is easily picked up by doing a routine echocardiography. Many of these individuals, they are at very high risk of developing sudden cardiac death, and most of this sudden cardiac death happens when they engage in some form of stressful physical activity. So any sports person, actually it is mandatory to get an echo done, and if they have this form of cardiomyopathy, then they are discouraged from engaging in any intense sporting or physical activity. So other individuals also who do intense workout, they should also do a screening echo to pick up this abnormality. Many of these individuals otherwise may not have any symptoms. And the other important reason for sudden cardiac death is sometimes what we call as cardiac arrhythmias. Cardiac arrhythmias can have varied causes. Sometimes some individuals can have some inherited forms of cardiac arrhythmias. Many other members of their families may have also died suddenly because of this. So if you have any history of sudden cardiac death in the family, then you should visit your doctor, you should visit your cardiologist and get evaluated. So this inherited arrhythmias can be picked up by proper and detailed evaluation. So now we have looked at the causes of sudden cardiac death in young people. Now what is the remedy for this? So first of all, we need to have a proper evaluation. If you are having any symptoms, anytime any sweating, even if it is mild, if you had any chest discomfort or breathing discomfort while working out or while walking, climbing stairs, then you should not ignore it. You should go to a doctor and get properly evaluated. If we have risk factors for the development of heart attacks, such risk factors can be diabetes, it can be high blood pressure, it can be high cholesterol level, it can be physical inactivity, it can be a family history of coronary artery disease. If all these risk factors are also there, then also we should do a screening checkup to detect any coronary artery disease at an early stage. If we have diabetes, we should take proper care of diabetes right from the time it is diagnosed. If we don't take care of diabetes over a period of time, it can lead to development of blockage in your coronary arteries. Similarly, if you have a blood pressure, you should get your blood pressure checked by your physician, take regular medicines, take a diet which is less in salt to keep your blood pressure under control. If the blood pressure is under control, it will not lead to other complications associated with high blood pressure. Similarly, if you have a high blood cholesterol levels, then also you should take your medications properly, get your levels checked every 6 months to see that they are under control. You should also consume a diet which is not rich in saturated fats. Diet can have a good quantity of unsaturated fatty acids which are good, but saturated fats and trans fats should be avoided in the diet. Similarly, people who smoke or use tobacco in any form, they should stop it immediately, because tobacco is a very important cause of development of heart attacks in young individuals. People who are obese, they should do a regular exercise, they should try to maintain normal BMI. And people who lead a sedentary lifestyle, they should also undergo some sort of aerobic physical activity at least 30 minutes every day, which can be in the form of brisk walking, it can be in the form of jogging, it can be in the form of swimming, it can be in the form of any dance form such as Zumba. So these are very important to mitigate this risk.